Let's see an NCLEX RN video based on that adult client with a mental health disorder. A client with a diagnosis of major depression who has attempted suicide says to the nurse, "I should have died. I have always been a failure. Nothing ever goes right for me." The therapeutic response to the client is, "I don't see you as a failure. You have everything to live for. Feeling like this is all part of being ill. You have been feeling like a failure for a while." So, the option "you have been feeling like a failure for a while." This type of responding to the feelings expressed by a client is an effective therapeutic communication technique. This is an example of the use of restating. Option 1, 2 and 3 block the communication because they minimize the client's experience and do not facilitate exploration of the client's expressed feelings. A community health nurse visits a client at home. The client states, "I haven't slept at all the last couple of nights," which response by the nurse illustrates a therapeutic communication technique for this client. Go on. Sleeping? You have been difficulty sleeping? Sometimes I have trouble sleeping too. So here when the nurse is asking, "You are having difficulty sleeping," it uses the therapeutic communication technique of restatement. Although restatement is a technique that has a prompting component to it, it repeats the client's major theme, which assists the nurse to obtain a more specific perception of the problem from the client. A client admitted to the mental health unit is experiencing disturbed thought process and believes that the food is being poisoned. Which communication technique would a nurse plan to use to encourage the client to eat? Using open-ended questions and silence, focusing on self-disclosure regarding food preferences, list possible reasons in the care plan that the client may not want to eat, offering options about the necessity of adequate nutrition. Open-ended questions and silence are strategies used to encourage clients to discuss their problems. If you see the options 3 and 4, they are not helpful to the client because they do not encourage the client to express the feelings. The nurse should not offer opinions and should encourage the client to identify the reasons for the behavior. Option 2, it is not a client-centered intervention. A client is admitted to a mental health unit for a treatment of psychotic behavior. The client is at the locked exit door and is shouting, "Let me out, there is nothing wrong with me. I don't belong here." A nurse analyzes this behavior as denial, projection, regression, rationalization. So denial is a refusal to admit to a painful reality which is treated as if it does not exist. In projection, a person unconsciously rejects emotionally unacceptable features and attributes them to other persons, objects or situations. In regression, the client returns to an earlier, more comforting, although less mature way of behaving. Rationalization is justifying illogical or unrealistic ideas, actions, or feelings by developing acceptable explanations that satisfy the teller and the listener. A client says to the nurse, "I am going to die and I wish my family would stop hoping for a cure. I get so angry when they carry on like this. After all, I am the one who is dying." The therapeutic response by the nurse is, "Have you shared your feelings with your family? I think we should talk more about your anger with your family. You're feeling angry that your family continues to hope for you to be cured. Well, it sounds like you are being pretty pessimistic. After all, years ago, people die of pneumonia." Restating is a therapeutic communication technique in which the nurse repeats what the client says to show understanding and to review what was said. So here the option 3. You are feeling angry that your family continues to hope for you to be cured, uses the therapeutic technique of restating. In option 1, the nurse is attempting to assess the client's ability to discuss feelings openly with family members. In option 2, the nurse attempts to use focusing, but the attempt to dismiss central issues is premature. In option 4, the nurse makes a judgment and is non-therapeutic in the one-to-one relationship. A nurse employed in a mental health unit is assigned to care for a client admitted to the unit 2 days ago. On review of the client's record, the nurse notes that the admission was a voluntary admission. Based on this type of admission, the nurse anticipates which of the following. The client will resist treatment measures. The client will be angry and will refuse care. The client's family will resist treatment measures. The client will participate in the planning of care and treatment plan. So here if you see option number 4, the client will participate in the planning of care and treatment plan. Generally, the client seeks voluntary admission. A voluntary admission permits a client to make a written application for admission. If the client seeks voluntary admission, the most likely expectation is that the client will participate in the treatment program. Options 1, 2, 3 are not characteristics of this type of voluntary admission. A nurse enters a client's room and the client is demanding release from the hospital. The nurse reviews the client's record and notes that the client was admitted 2 days ago for treatment of an anxiety disorder and that the admission was a voluntary admission. Which of the following actions would the nurse take? Contact the physician, call the client's family, persuade the client to stay a few more days, tell the client that discharge is not possible at this time. So here we need to contact the physician. Generally, the client seeks voluntary admission. Voluntary clients have the right to demand and obtain release. If the client is a minor, the release may be contingent on the consent of the parent or guardian. The nurse needs to be familiar with the state and facility policy and procedures. Many states require that the client submit a written release notice to the facility staff members who re-evaluate the client's condition for possible conversion to involuntary status if necessary according to criteria established by laws. The best nursing action here is to contact the physician. A client has been admitted to the mental health unit. On admission assessment, nurse notes that the client was admitted by involuntary status. Based on this type of admission, the nurse would most likely expect that the client presents a harm to self, requested the admission, consented to the admission, provided written application to the facility for admission. Involuntary admission is made without the client's consent. Involuntary admission is necessary when a person is a danger to self or others or is in need of psychiatric treatment. Option 2, 3 and 4 describe the process of voluntary admission. The nurse is preparing a client for the termination phase of the nurse-client relationship. The nurse prepares to implement which nursing task appropriate for this phase. Planning short-term goals, making appropriate reference, developing realistic solutions, identifying expected outcomes. So here, the nurse has to make appropriate referrals. Tasks of the termination phase include evaluating the client's performance, evaluating the achievement of expected outcomes, evaluating future needs, making appropriate referrals, and dealing with the common behaviors associated with termination. Here options 1, 3 and 4 identify the task of the working phase of relationship. A nurse is providing care to a client admitted to the hospital with diagnosis of acute anxiety disorder. The client says to the nurse, "I have a secret that I want to tell you. You won't tell anyone about it, will you? The appropriate nursing response would be which of the following? No, I won't tell anyone. I cannot promise to keep a secret. If you tell me the secret, I will tell it to your doctor. If you tell me the secret, I will need to document it in your record. So here the nurse need to tell, I cannot promise to keep a secret. The nurse should never promise to keep a secret. Secrets are appropriate in a social relationship but not in a therapeutic one. The nurse needs to be honest with the client and tell the client that a promise cannot be made to keep a secret. Options 1, 3 and 4 are inappropriate responses. A nurse employed in a mental health clinic is greeted by a neighbor in a local grocery store. The neighbor says to the nurse, "He is Carol doing? How is Carol doing? She is my best friend and is seen at your clinic every week." The appropriate nursing response is which of the following? I cannot discuss any client situation with you. If you want to know about Carol, you need to ask her yourself. I'm not supposed to discuss this, but because you are my neighbor, I can tell you that she is doing great. I'm not supposed to discuss this, but because you are my neighbor, I can tell you that she really has some problems. So here the nurse need to tell, I cannot discuss any client situation with you. The nurse is required to maintain confidentiality regarding the client and the client's care. Confidentiality is basic to the therapeutic relationship and is a client's right. The most appropriate response is thus option 1. Option 2 is a blunt statement and does not acknowledge the issue that the nurse cannot reveal if the named person is or was a client. Option 3 and 4 identify statements that do not maintain client confidentiality. So here option 1 is the most direct and correct. A client was admitted involuntarily to the mental health unit because of the episodes of extremely violent behavior. The client is demanding to be discharged from the hospital and the nurse does not allow the client to leave. Which of the following represents the legal ramifications associated with the nurse's behavior? The nurse will be charged with assault. The nurse will be charged with slander. The nurse will be charged with imprisonment. No charge will be made against the nurse because the nurse's actions are reasonable. So here, no charge will be made against the nurse because the nurse's actions are reasonable. False imprisonment is an act with the intent to confine a person to a specific area. A nurse can be charged with false imprisonment if the nurse prohibits a client from leaving the hospital, if the client has been admitted voluntarily, and if no agency or legal policies exist for detaining the client. If the client has been admitted involuntarily or had agreed to an evaluation before discharge, the nurse's actions are reasonable. Nurse is working with a client who has sought counseling after trying to rescue a neighbor involved in a house fire. Despite the client's efforts, the neighbor died. Which action does the nurse engage in with the client during the working phase of the nurse-client relationship? Exploring the client's ability to function, exploring the client's potential for self-harm, inquiring about the client's perception or appraisal of the neighbor's death, inquiring about and examining the client's feelings that may block adaptive coping. So here the client must first deal with the feelings and negative responses before the client can work through the meaning of the crisis. So here option 4 pertains directly to the client's feeling. Option 1 and 2 do not directly address the client's feeling, and option 3 does not directly focus on the client's feeling. So here in the working phase of the nurse-client relationship, the action is inquiring about and examining the client's feelings that may block adaptive coping. A client who has just been sexually assaulted is calm and quiet. Nurse analyzes this behavior as indicating which defense mechanism? Denial, projection, rationalization, intellectualization. So here denial. Denial is refusal to admit a painful reality and may be a response by a victim of sexual abuse. Projection is transferring one's internal feelings, thoughts, and unacceptable ideas and traits to someone else. Rationalization is justifying the unacceptable attributes about oneself. Intellectualization is the excessive use of abstract thinking or generalization to decrease the painful thinking. Unresolved feelings related to loss most likely may be recognized during which phase of therapeutic nurse-client relationship? Working, trusting, orientation, termination. So here it is the termination phase. The relationship comes to a close in this phase. Ending treatment sometimes may be traumatic for clients who have come to value the relationship and the help. Because loss is an issue, any unresolved feelings related to loss may resurface during this phase. Options 1, 2, and 3 are incorrect. A nurse in the mental health unit reviews therapeutic and non-therapeutic communication techniques with the nursing client. Which of the following are therapeutic communication techniques? Select all that apply. Restating, listening, asking the client why, maintaining neutral responses, giving advice or approval or disapproval, providing acknowledgement and feedback. So here the options of restating, listening, maintaining neutral responses, and providing acknowledgement and feedback. Therapeutic communication techniques include all these things. So it includes listening, maintaining silence, maintaining neutral response, using broad openings and open-ended questions, focusing and refocusing, restating, clarifying and validating, sharing the perceptions, reflecting, providing acknowledgement and feedback, giving information, presenting the reality, encouraging formulation of a plan of action, providing non-verbal encouragement and summarization. Hope you understood this video. Please do keep watching. Thank you.